Next case is an example of first trimester bleeding. A 25-year-old woman at 11 weeks of gestation presents with vaginal bleeding. So this patient is within the first trimester. Within the first trimester. The first trimester is within the first 12 weeks. Presents with vaginal bleeding and lower abdominal pain. On speculum examination, products of conception are visible at the cervical os. What finding best confirms the diagnosis? Serum beta human chorionic gonadotropin, abdominal ultrasound, transvaginal ultrasound, CT scan, pelvic X-ray, transvaginal ultrasound. Why? Transvaginal ultrasound can confirm the type of miscarriage, the fetal viability, and can exclude the ectopic pregnancy. So here there's vaginal bleeding and there's products of conception are visible at the cervical os. These products of conception that is visible at the cervical os could be miscarriage, could be ectopic pregnancy. So how to distinguish between the miscarriage with dead fetus and the ectopic pregnancy with viable fetus? This could be ectopic pregnancy within the cervix. So transvaginal ultrasound is the only method to see the fetal viability and the type of miscarriage or ectopic pregnancy. Why the other options are incorrect? Beta human chorionic gonadotropin alone is non-specific. Abdominal ultrasound. The beta human chorionic gonadotropin is non-specific. If it is alone is non-specific. Abdominal ultrasound is less sensitive early. Abdominal ultrasound early in the first trimester is less sensitive. Transvaginal ultrasound is the best investigation method in the early pregnancy. Abdominal ultrasound is less sensitive in the early pregnancy. Of course, CT and X-ray are contraindicated in the early pregnancy. This is a case of ectopic pregnancy. 25-year-old female with abdominal pain and positive pregnancy test. Longitudinal ultrasound image of the uterus shows an irregular intrauterine fluid collection lined by a thin echogenic rim. There is an irregular intrauterine collection lined by a thin rim. This is a longitudinal image of the uterus. This is transvaginal ultrasound. Okay, there is a fluid collection and irregular intrauterine fluid collection. Okay, however, no sac is seen. Sorry, there is no fetus it's only a fluid collection. This is the pseudo-gestational sac, okay? Transverse ultrasound image of the right adnexa shows an echogenic structure with central anechoic component. Echogenic structure with central anechoic component. So here there is an echogenic structure with central anechoic component. This is the uterus. This is the right adnexa. This is the right adnexa. Okay. And in between the uterus and the right adnexa, there is an echoic structure. Sorry, there is an echogenic structure with an echoic central area. Transverse ultrasound image of the right adnexa shows an echogenic structure with central anechoic component located between the right ovary and the uterus. So this lesion located between the uterus and the right adnexa, indicating that this is in the tube, right fallopian tube. Within the right fallopian tube, echogenic structure with central anechoic component. This is the ectopic pregnancy. A magnified image of the left adnexal lesion. This is the right adnexal lesion. Okay, so a magnified image of the right adnexal lesion. The central anechoic component has a small yolk sac with possible embryo. So this is the magnified image. I will magnify it more for you. This is the magnified image of the right adnexal lesion. This is the echogenic structure with a central anechoic structure. The central anechoic structure contains the central anechoic component has a small yolk sac and possible embryo. A small yolk sac and possible embryo. Yes, this is the yolk sac and the embryo. So this is the ectopic pregnancy here in the right adnexa. The image of the hepatorenal fossa demonstrates free abdominal fluid. There's free abdominal fluid at the hepato. This is the liver. This is the kidney. This is the hepatorenal fossa. There's free abdominal fluid at the hepatorenal fossa. Demonstrate free abdominal fluid. In this patient with positive pregnancy test, the intrauterine fluid collection without yolk sac or fetal pool may represent very early intrauterine pregnancy or pseudo-gestational sac of ectopic pregnancy. So this fluid collection within the uterine cavity may represent very early gestational sac or blighted ovum, or pseudo-gestational sac of ectopic pregnancy. Why? Because this fluid collection doesn't contain any yolk sac or fetal pool. The management is surgery or methotrexate. This patient should receive the methotrexate for the ectopic pregnancy or surgery. Methotrexate or surgery. This is another case of ectopic pregnancy, which is demonstrated by transvaginal ultrasound. In the previous case, the ectopic pregnancy was adnexal, okay, within the fallopian tube. However, here, the ectopic pregnancy here is within the interstitial portion of the fallopian tube. Okay, so you will see the ectopic pregnancy here is not between the uterus and the ovary as in the previous case. It's seen within the interstitial portion of the right fallopian tube. Okay, it will be seen within the right corner of the uterus. Okay, so it is within the right corner of the uterus and not within the lumen, not within the endometrial cavity. That's why it is ectopic. It's seen within the interstitial portion of the right fallopian tube. So what is the most likely diagnosis? This is ectopic pregnancy. Can you see how the transvaginal ultrasound is sensitive in detecting the ectopic pregnancy, gestational sac, and fetal pool? It can visualize the fetal pool in the early pregnancy. What laboratory test could be ordered for confirmation whenever you see this ectopic pregnancy? Confirm with beta human chorionic gonadotropin. So the laboratory test is serum beta human chorionic gonadotropin, and this is right-sided interstitial ectopic pregnancy. Does a normal ultrasound exclude ectopic pregnancy? No. What is the leading cause of pregnancy-related death in the first trimester? Ectopic pregnancy. So ectopic pregnancy is the leading cause of pregnancy-related death in the first trimester, because this ectopic pregnancy may lead to rupture this ectopic pregnancy may rupture, and this may lead to death in the first trimester. So again, transvaginal ultrasound is the only method to confirm the type of miscarriage, fetal viability, and exclude ectopic. Okay. In this case, on speculum examination, products of conception are visible at the cervical os. Okay. Why we suspect here ectopic pregnancy? As I mentioned, ectopic pregnancy is a pregnancy gestational sac that is not seen within the endometrial cavity. It can be seen in the cervical ectopic pregnancy can be implanted in the cervix, so product of conception can be visible at the cervical os. Ectopic pregnancy also can be implanted in the interstitial portion of the fallopian tube or within the ampulla of the fallopian tube. So whenever you see on a speculum examination products of conception are visible at the cervical os, suspect ectopic pregnancy, and transvaginal ultrasound is the only method to confirm.